Yeah. Okay. Welcome, everybody. Good afternoon, and welcome to Beyond Telehealth. And I'm honored to introduce my friend, Dr. Kevin McGarvey, who is going to introduce himself and talk to us about his company, Hippo Health. So, Kevin, we have 5 minutes with the think. So let's see if we can do it. So introduce yourself. Tell us what specialty you practice and where you practice. Please.
Yeah, Kevin McGarvey, emergency physician, practicing in Colorado.
Okay, and tell us why you started your company, Hippo Health, especially since it was way before COVID, pre-COVID, when we first met a few years ago. Give us the why you started your company.
So as an emergency physician, Lisa, and as I know you've experienced as a physician, our co-founding team felt the modern day healthcare experience was broken. And we felt a large part of that was due to lack of easy communication, not just between patients and providers, but also in between care teams. And my medical group got acquired about 4 years ago. I decided to make a leap of faith to try to build something that was different for telemedicine and care delivery. Our team had worked on a number of telemedicine platforms, and we found a universal problem where we couldn't easily connect with our own trusted colleagues in our own community for delivering that last mile of care. So I wasn't able to see a patient virtually and then easily refer them or coordinate care for that next step in their own local community while I was practicing medicine or doing telemedicine. And we set out to solve for that problem. We've built our own care network platform that's now in the market and getting used by a number of different specialties in different communities. And we think that it's going to become a more and more prevalent tool based on some of the limitations we still see in telemedicine with care coordination and referral capabilities.
So it's based on using an app, right? So this network is very easily attainable because it's right on your phone and you can connect with your patients directly on this app, which again, you were very forward thinking a few years ago, which is amazing.
Yeah, I think we just found a problem that we saw within the industry, within telemedicine, and being a physician, we tried to build an app that was really meeting the needs of physicians and care teams and clinicians. So now we're starting to see some of the benefits of that in actual practice with patient care and making it easier for a patient to talk to their doctor and their care team, but then allowing that care team to talk to other care teams in the community as well for that integrated local virtual care network that we think will really be a part of the 21st century medicine.
So has anything changed since COVID with the why of Hippo Health or how it works?
I don't think our why has really changed. How it works hasn't really changed. We've definitely seen some new use cases pop up with COVID. We saw massive growth about 5 months ago. We had 1,200% paid user growth in about 2 weeks. So rapidly scaled up to serve a number of care teams and established medical groups during the first wave of COVID. And now we're starting to see a lot of usage around COVID testing, especially in university settings. We're also starting to develop relationships with EMS and mobile care teams for what some parts of EMS call mobile integrated healthcare, where essentially I can do telemedicine. I could do telemedicine with a patient one-on-one, or I could even do telemedicine and have a paramedic or an EMT at a patient's home doing an exam, delivering medications, doing an EKG or what have you to do a more in-depth evaluation, and allowing my ability to practice medicine reach way beyond bricks and mortar for taking care of my patients.
It's really innovative, Kevin. So let's leave everybody with, we're at 5 minutes, but let's tell the story of how did you come up with the name Hippo Health?
So, Lisa, we both took an oath as physicians, and with taking the Hippocratic Oath, we wanted to remind our colleagues that we're all in this to help our fellow human beings and really take care of people. We're trying to get back to the basics of that, and we think that telemedicine can start to enable that better connection that's just as simple, talking to patients, communicating with people, and making a difference in people's lives. So Hippo is not just a large mammal in Africa, it's also in reference to the Hippocratic Oath.
Well, I love that story. That's a great story. And it's a good place to end. So, Kevin, thank you so much. I really appreciate you helping our fellow physicians and patients learn a little bit more about telemedicine.
Awesome.
So,
thank
you.
All right.
Bye. Bye.